hyperactivity disorder, better known as ADHD, is a condition linked to difficulty focusing on some tasks or subjects.
But the prescribed medications are showing up on college campuses and not necessarily to treat ADD. WCBI's Victoria Bailey sat down with some experts. She's now live in the studio with more on the impacts of so-called study drugs. Victoria.
That's right, Joey and Andrea. People diagnosed with ADD or ADHD are usually prescribed medicines like Adderall or Ritalin. However, it's the effects of the medication that's landing the pills in the hands of those without prescriptions, but who might want a little pick-me-up.
Mississippi State University student Mary Nicholson has been taking a form of Adderall since she was diagnosed with ADD in the 3rd grade. Now, since she's been in college, her doctor has changed the amount she can get at the pharmacy at one time. The main reason? To prevent illegal use among co-eds.
It's because of people abuse it so badly, especially college students. I have to go to the doctor every month to get a refill on it. You can't medically get a refill. So you have to go and you wait in the doctor's office. You have to see the doctor and then they have to give it to you.
Students are apparently using the drug to help them focus during crunch times.
If you want to pound out a paper the night before because you procrastinated, that's what people assume is the best way to do that.
Studies show the use of drugs like Adderall or Ritalin has skyrocketed among college students in the last 2 decades.
And by nature, they are a drug that can be rewarding, and as a result, for those of us who have maybe a proclivity towards substance abuse or a substance use disorder, it can be kind of dangerous.
Keenan Wald is a licensed professional counselor at Pines and Katy Hill Recovery Center. He adds students are drawn to the drug's ability to assist with focus, great attention to detail, and of course cutting out those trips to the cafeteria.
At the same time, if something is that effective, I don't learn to develop my own behavioral style to try and manage that distress. My skills to manage my symptoms are just not present, and so then it's almost like being a live wire in a puddle.
Wald says what students don't realize is the stimulants pick you up, but what's up has to come down.
There is kind of a rubber band effect, we call it, right? Essentially the snapback of what the stimulant medication does. So the next day they may be more tired, they may feel actually more scattered, their anxiety may be more elevated.
Now, Wall added, if you were diagnosed with ADD or ADHD at an early age, it's possible that you've outgrown your diagnosis. Be sure to check with your physician about your specific case. Andrea, Joey?
All right, Victoria in our studio with that.